Thank you. Senator Bennet.
Thank you, Mr. Chairman, and thank you for the witnesses for being here. Mr. Chairman, you said at the outset of this hearing, I think, an extraordinary thing for the chairman of the Senate Finance Committee in the time that I've been here, and that is that the American healthcare system is broken. That's an emphatic statement, and it's a statement that I completely agree with. And from the standpoint of the people that I represent in Colorado, where they're suffering day after day after day with the effects of a system that costs them twice as much as the healthcare system of any other wealthy country, any other industrialized country in the world, a system that provides them so much less than those other healthcare systems around the world are providing. I could not agree more with that observation. In other countries that we compete with, that are spending half what we're spending on healthcare, and the half is the federal government, the half is small businesses, the half is families that are all spending twice as much as other industrialized countries around the world. In those other countries, they expect as a right access to primary care, access to mental health care, access to maternal care, access to affordable prescription drugs. President Trump has talked about that over and over again. Hospitals that have enough doctors and enough beds and enough time for somebody who's gotten sick to actually spend time there and get well. A lot of times in life you pay a little, but you get a little. There are rare moments in life, I suppose, when you pay less and get more. But that's true of people that are living in these other healthcare systems. And I think the immediate task before us is to extend these tax credits for the Affordable Care Act. We have to do that because otherwise, in our states, people are going to see increases of 200% for healthcare, 300% for healthcare, 400% for healthcare. In rural and urban Colorado, in rural and urban America, that is what they're going to face because of the negligence of people in Washington that are now discovering that our healthcare system is broken. But that's not going to fix our system. That's just going to save people from going bankrupt in the short term. We've got to fix the system that we have. And when the Affordable Care Act was coming through here and we were trying to regulate the insurance companies by saying you can't throw off Americans because they have a pre-existing condition, you can't throw off Americans because they have cancer. These guys were all against that because we were regulating the private insurance company in America and that was going to be bad. And now they're here to say the private insurance company is a fraud scheme. That's also an amazing thing to hear on the Finance Committee, but it's welcome from my perspective. And I'll be honest about it. I support a universal health care system in America. I think we should have a universal health care system in this country because I think the American people deserve to spend half of what we're spending on health care and get a better result. I think people in Colorado deserve to have the chance to have mental health care for their children, just like people across the industrialized world, rich countries around the world that are not infected by the special interest politics that have driven drug prices through the roof, that have driven insurance prices through the roof, that have caused us to have a system that rewards over and over and over again, to Doug Holt-Seitzman's point, fee for service, fee for service, fee for service, pay as much as possible, instead of putting us in a system where we can actually take better care of ourselves and live better lives and live longer lives. Do you know that the average life expectancy in this country is 6 years less than in those other countries that have systems of health care that cost half as much? And I don't have time, and let me just finish by saying I don't think the answer here is a command and control answer from Washington, D.C. Quite the opposite. I think we should give everybody in America a public option that is administered by Medicare that gives every family in America the chance to decide whether they can get out from underneath the insurance industry that you're talking about get in a plan where they can actually see the benefit of being in a place with managed care and the chance to be able to take better care of themselves and be rewarded for that, instead of be at the whim of the drug companies and the whim of the insurance companies. Mr. Levitin, in my last 5 seconds, do you have anything you'd like to say about that?
Briefly, please.
Very briefly, I would be happy to say that, yes, insurance is not perfect, but people need insurance. And we need to make it affordable for people. And whatever flaws it has, we shouldn't punish the people who need insurance by not making it affordable for them.
Exactly. Let's fix the system before we double, triple, and quadruple the prices on the American people.
Thank you.